Hey there, I'm Vivian from Trusted Senior Specialist, and this is your Medicare question of the day. So, this is from Ashley from North Dakota, and she says, I'm turning 65, I have a group coverage, and I'm still working. What do I need to do next? Well, Ashley, you asked the right people here at Trusted Senior Specialist. So you can see this is our call center where we all attend your needs and wants, right? So we're going to find you your answer. And this is Eduardo. This is one of our Trusted Senior Specialist agent. Hi, Eduardo. How's it going?
How's it going?
So I have a question for you.
All right.
This comes from Ashley from North Dakota. She says, I'm turning 65. I have a group coverage and I'm still working. So what do I need to do next?
Great question. Hi, Ashley from North Dakota. That's a pretty common question. Unfortunately, there's no easy answer. So what I'm going to do is I'm going to kind of give you some tips and some action items on what to do. So the very first thing, not all insurance is created equal. So we definitely want to make sure that we are, number one, getting your monthly premium. When I talk about monthly premium, you also probably want to take a look at any HSA accounts that you may have. So if you have, like, I'll give you an example. One of my customers has a monthly premium of $350 and they have an HSA account of $50. So their all-in monthly premium is going to be $400. Okay? The next next point that you want to take a look at is going to be your deductible. Your deductible is the financial responsibility that you need to take care of before the plan does anything at all. So your deductible. The next point is going to be your max out of pocket. So those three financial responsibilities you want to kind of gather up, and then that's kind of how you start to compare the plan that you currently have versus what you can get. The next point, which is the fourth point, is what happens when you turn 65. Some plans are going to go ahead and cut you off of the plan, which means you totally lose it. Some of them will keep you on. Some of them will have a rate increase on your monthly premium. So that's really going to be able to play a factor as well. Really, what it's going to come down to, and what I encourage you to do, is call in at 855-347-9302. And what we'll do is we'll actually take the numbers that you have and show you exactly what you can get in the Medicare market. And then really, the answer is going to stick out like a sore thumb. It's going to actually show you exactly what you need to do, what makes financial sense for you, what's going to give you the most bang for your buck when it comes to your health care. So that's really how I would answer Ashley from North Dakota.
Well, thank you so much, Eduardo. And one last thing before we leave.
Okay.
What are you doing for Father's Day?
Oh, what am I doing for Father's Day? So that's going to come into probably two different forms of answers here. I'm going to tell you what I would like to do, and I'm going to tell you what's reality. Okay, so what I'd like to do is probably sleep in, probably hit the pool, and then have a nice king-size dinner. Reality is probably going to tell me about 5:30, 6 o'clock, my kids are going to come in the room. They're going to start jumping on the bed to get me up. They're going to wake me up, and we'll probably hit one of the breakfast spots. So I'll have hopefully a good, solid breakfast, and then they'll probably wear me out for the rest of the day. But again, I love my kids, love my wife. It's definitely going to be a great Father's Day, regardless of what happens.
There you have it, guys. So as well, you can call us at 855-474-6234 for more information. Leave us your comments or questions on our social media channels as well. And from all of us in Trusted Senior Specialists, Medicare is all about love and trust, and we hope you all have a happy Father's Day.
Love y'all.
Oh my gosh, I never say y'all. Hi there. If you're turning 65 soon, please pay close attention to the following information that we're about to give you. Welcome to another Medicare question of the day. Today we are with Samira. She's one of our Trusted Senior Specialist agent. Hi, Samira. How are you?
Good. How are you?
Good. Thank you for joining us. So, Samira, this question comes from Sandra Johnson from California. So, she says, isn't it better to just have original Medicare?
Thank you, Vivian. In most cases, no. Why? Because Medicare only covers you 80% of hospital, which is Part A, and 80% of medical, which is just Part B. And medical means only specialist and doctors' bills. And Part A, the hospital deductible, it's $1,340. So being on original Medicare, you're going to have to not just pay the 20%, but you will also have to pay the hospital deductible, which is $1,340, and the medical deductible, which is $183 once a year. So there are plans as little as $0 in most of states and counties, and you can always give us a call and we can see what else is out there, because it may not be a good idea to stay on original Medicare and pay the 20% of whatever, because Medicare does not have a ceiling. You can pay 20% of whatever you get done.
Thank you, Samira, for that information. Keep on sending us your questions by mail, email, or the best thing you can do is call us directly at 855-474-6234, and one of our licensed specialists will assist you. Don't forget to comment, like, and share this video, and stay tuned for more Medicare questions of the day. And here at Trusted Senior Specialist, when it comes to your Medicare, it's all about love and trust. Till next time.
Bye.
Hi there. If you're turning 65 soon, please pay close attention to the following information that we're about to give you. Welcome to another Medicare question of the day. Today we are with Samira. She's one of our licensed agents here at Trusted Senior Specialist. Hi Samira, how are you?
Good, how are you?
Good, thank you for joining us. So Samira, this comes from Elizabeth Hutchins, and she's from Texas. And she says, why pay $134 for Medicare if you still have to get supplement insurance? Why not just get supplement insurance instead?
Thank you, Vivian. Hi, Elizabeth. Thank you so much for this question. And the question was, why do I have to get Medicare? Why not just get a supplement? Unfortunately, supplements only cover the 20% of what Medicare do not cover. So you will have to have the primary insurance, which is Medicare 80%, in order for a supplemental insurance to pay the rest of the 20%. But there are plans as little as $0 in most cities and counties that will offer the 20% with some little co-pays, and I would suggest you call us or any of our licensed agent here, and we will definitely see what's available there.
Thank you, Samira, for that information. Keep on sending us your questions by mail, email, or the best thing you can do is call us directly at 855-474-6234, and one of our licensed specialists will assist you. Don't forget to comment, like, and share this video, and stay tuned for more Medicare questions of the day. And here at Trusted Senior Specialist, when it comes to your Medicare, it's all about love and trust. Till next time.
Bye.
Buenas tardes. Soy Adriana Gómez de Trusted Senior Specialist. Nuestra compañera Vivian no pudo estar el día de hoy con nosotros, pero aquí le tenemos la pregunta de Medicare del día. La pregunta de hoy es, ¿tengo que ser ciudadano americano para poder calificar para el Medicare? La respuesta es que no. No necesariamente tiene que ser ciudadano americano para calificar para el Medicare. Siempre y cuando esté legal en este país, ya sea con residencia permanente, residencia temporal, o incluso permiso de trabajo, y usted haya trabajado los 40 créditos del Seguro Social, que es equivalente a 10 años de trabajo en los Estados Unidos, usted califica para el Medicare. Y es muy importante que usted lo sepa, porque ha habido muchos casos de muchas personas que no aplican pensando que no van a calificar. Por ejemplo, un caso de un cliente mío que es muy importante. Él nació en México, se vino para los Estados Unidos y arregló su estatus migratorio aquí en los Estados Unidos. Es residente temporal. Él a los 65 años decidió no aplicar para el Medicare porque pensó que no calificaba. Y él trabajó sus 40 créditos en los Estados Unidos. Ahora, él a los 69 años de edad se enfermó y necesitó cobertura médica. En ese tiempo nos llamó a nosotros por ayuda. Nosotros le pudimos ayudar a aplicar para el Medicare, pero hubo un problema. Él fue penalizado porque no aplicó para el Medicare cuando cumplió los 65 años. El Medicare les da 3 meses antes de cumplir los 65 años, el mes de y 3 meses después de cumplir los 65 años para aplicar para el Medicare. Si no lo hace dentro de ese tiempo, usted es penalizado. ¿Okay? Por eso es muy importante que ya no busque ningún otro lugar. Llámenos el día de hoy, ahora, o nosotros le podemos ayudar con cualquier duda o pregunta que usted tenga. En cualquier caso en específico que usted tenga, aquí estamos para ayudarle. El número de teléfono de nosotros es el 1855-347-9302. Llámenos el día de hoy y muchísimas gracias por habernos sintonizado. Espere nuestra siguiente sintonización de la pregunta del Medicare del día.
This is a must-watch video. Hi, Carmelita. How are you?
Hey, I'm pretty good, Vivian. Nice to see you.
Good, good. So,
Do you have a Medicare question for me today?
of course, and this is really an important question, Carmelita, for
Okay.
you. This comes from Mr. Sandoval in Illinois, and he's asking, he's asking, if I'm a permanent resident in the United States, can I have Medicare?
That's a good question. So, Mr. Sandoval, to answer your question, my answer actually is it depends. If you have worked in the United States for at least 10 years, equivalent to 40 quarters, you are eligible for Medicare because you've been paying your Social Security taxes and also Medicare. And one good news for other non-U.S. citizens here in the United States, if you have worked, if you only have like a permanent visa, work visa, and you've worked for like 10 years, you qualify for Medicare. So that's good news because a lot of people think you have to be 65 and you have to be U.S. citizen. So there's another options for you. Okay, folks, until next time.
Thank you for that information, Carmelita.
Oh, my pleasure.
So don't forget, keep sending your questions via email, by mail, or better yet, call us directly at 855-474-6234, and one of our licensed specialists will assist you.
Oh, by the way, Vivian, I'd like to add something to that. A lot of people think we charge for our services. What they don't know is we don't charge consultation fee. So folks, don't be scared to give us a call. We'll be happy to assist you.
And stay tuned for more Medicare questions of the day. Don't forget, here at Trusted Senior Specialist, when it comes to your Medicare, it's all about love and trust. Until next time.
Absolutely.
Hi there. If you're turning 65 soon, please pay close attention to the following information that we're about to give you. Welcome to another Medicare question of the day. Today we are with Samira. She's one of our licensed agents here at Trusted Senior Specialist. Hi, Samira. How are you?
Good, how are you?
Good. Thank you for joining us. So, Samira, this question comes from Terry Brown from Tennessee. And he says, how can I get supplement insurance? My income is very small. I only get $800 a month.
Thank you, Terry. This is a really good question, and I get this question a lot. And there's a lot of people that actually need assistance, and they do not have a lot of money to pay for Medicare and supplements and prescription drug plans. So I really commend you into looking into this. There is help out there, assistance by government, Social Security, and it's called low-income subsidy, or you can call it extra help on paying prescription drugs cost. If you're making $1,517 being single, or $2,057 being married and living together, then Social Security will pay for your drug cost up to 75%. And there's also another assistance by your state called Medicare Savings Program. And if you're making $1,200, anywhere around that, you can get SLMB. They will pay your Medicare premium, but you will have to pay the 20%. But if you're making under $8,000 monthly income, then there is the Medicare Savings Program called QMB, and they will not just pay the Medicare premium for you, but also the 20%. So there is definitely help out there. I would suggest you call us, and we will definitely see what you qualify for. Thank you.
Thank you, Samira, for that information. Keep on sending us your questions by mail, email, or the best thing you can do is call us directly at 855-474-6234, and one of our licensed specialists will assist you. Don't forget to comment, like, and share this video, and stay tuned for more Medicare questions of the day. And here at Trusted Senior Specialist, when it comes to your Medicare, it's all about love and trust. Till next time.
Bye.
Watch this if you're a veteran. Hi Adriana, how's it going?
It's going great, Vivian. How about yourself?
Good, thank you for joining us. So Adriana, I have another Medicare question of the day for you.
Okay.
And this comes from Jerry Mathis. He's actually from Massachusetts and he's a veteran. And his question of the day is, if I don't get Part B, does Medicare penalize me for that?
Okay. Good question, Jerry. Now, regardless if you're a veteran or not, if you do not apply for Medicare when you turn 65, the Part B, and later in the future you decide that you want to apply for Medicare, you will be penalized.
So Adriana, what are your suggestions then?
There's really no specific suggestions for this. If you are a veteran and you go to the Veterans Administration, the Veterans Administration is credible prescription coverage, but is not credible medical coverage. But if you decide that you're never going to come out of the Veterans Hospital and you're just going to use their services, if you don't apply for Medicare, you will never be penalized. But if in the future you think that you will use services outside of the Veterans Hospital, you might want to think about applying for Medicare so you won't be penalized in the future if you decide to apply for Medicare later on.
Thank you for your information, Adriana. Again, keep us sending us your questions concerning Medicare by mail, email, or better yet, call us directly at 855-474-6234 when a licensed specialist will assist you. We offer consultations at no cost whatsoever. And stay tuned for more Medicare questions of the day. And here at Trusted Senior Specialist, when it comes to your Medicare, it's all about love and trust. Until next time. Watch this if you're a veteran. Hi Adriana, how are you?
I'm doing great. Thank you for asking. How about yourself?
Good, good. Thank you for joining us today.
My pleasure.
So Adriana, we have another Medicare question of the day, and this question comes from Patty Manil. She's actually from Oklahoma, and she's really concerned, Adriana. So she turns to the experts in here at Trusted Senior Specialist, and she's asking if there is a way to get help in order to pay for Medicare Part B premium.
Hi, Patty. There is a program that can assist you to pay your Part B premium. The program is called the Medicare Savings Program. It's a state program that if you qualify based on income and assets, they'll be able to help you pay that Part B premium, and they will no longer deduct that Part B premium from your Social Security benefits check.
So what are the guidelines and limitations?
Good question, Vivian. And Patty, the Medicare Savings Programs is a state program. So it varies by state. Each state has its limitations and its guidelines. If you do need assistance applying for that, we can actually help you here at no cost to you.
Thank you for your information, Adriana. Again, keep us sending us your questions concerning Medicare by mail, email, or better yet, call us directly at 855-474-6234 when a licensed specialist will assist you. We offer consultations at no cost whatsoever. And stay tuned for more Medicare questions of the day. And here at Trusted Senior Specialist, when it comes to your Medicare, it's all about love and trust. Until next time. This is a must-watch video. Hey Carmelita, how are you?
Hey, great. What's up? Do you have another question for me?
Of course, yeah, we have to test the experts out, right? And this comes from Elena Peterson from New York, and she's asking, what benefits does Medicare do not cover?
Okay, that's very simple. A lot of things, good things that Medicare don't cover, and some of them are hearing aid, dental care, fitness program, over-the-counter items, transportation, and many other supplemental benefits. Other plans call it optional supplemental benefits.
So where can they get these benefits?
All right, Vivian. Okay, to answer Vivian's questions, you can get these optional supplemental benefits through Part C or Medicare Advantage plan. There are so many HMOs and PPOs in your area, so you can check it out, or you can give us a call. Now, if you're interested on a standalone dental or also vision, there are plans available out there. Just give us a call and we'll be happy to assist you.
Thank you for that information, Carmelita.
Oh, my pleasure.
So don't forget, keep sending your questions via email, by mail, or better yet, call us directly at 855-474-6234, and one of our licensed specialists will assist you.
Oh, by the way, Vivian, I'd like to add something to that. A lot of people think we charge for our services. What they don't know is we don't charge consultation fee. So folks, don't be scared to give us a call. We'll be happy to assist you.
And stay tuned for more Medicare questions of the day. Don't forget, here at Trusted Senior Specialist, when it comes to your Medicare, it's all about love and trust. Until next time.
Absolutely.
Hey there. If you or any relative are about to turn 65, listen really close to the following information we're about to give you. We have been receiving this question from a lot of people right now. What is the best Medicare plan? So this is Jill, one of our Trusted Senior Specialist agent. Hi Jill, how's it going?
Hi, good to see you.
Good to see you too. So Jill, what do you have to say about this question?
There is no best Medicare plan. But let me tell you, when it comes down to Medicare, you have two options on how to cover the 20% that you will be responsible for when you turn 65. So if you don't want to have the additional out-of-pocket expenses or referrals to a doctor, then there's the Medigap plans, otherwise known as Medicare supplement plans. They'll provide you your coverage for Medicare Parts A and B. However, there is a monthly premium for it, and it does not cover your prescription drug coverage. So allow us to locate a drug plan or Part D that's available in your area that will have the lowest annual cost for you. Now, the other option would be Part C, otherwise known as Medicare Advantage Plan. And what they do is they provide your coverage for little to nothing a month. However, it will cover Medicare Part A, Part B, and it may cover your Part D prescription drug coverage. And it also will provide benefits like dental, vision, hearing that Medicare does not cover. But keep in mind, you will have to have your referrals through a doctor in network. And both of these will require you to have Parts A and B of Medicare maintained. So please keep that in mind. With the Medicare supplement, after 6 months of turning 65, you will have to answer a series of health questions to be enrolled in a Medigap plan. So allow us once again to assist you in locating the plans that are available in your area, because they do vary from state to state. But just give us a call and we'll be able to assist you in that.
Definitely. Thank you so much, Jill. So there you go, guys. Don't forget to comment below if you have any other questions that we could definitely answer, or call us directly at 855-474-6234 for every other question or information that you can want a licensed agent to assist you with, okay? So don't forget to comment, like, or share this video, and stay tuned for more Medicare questions of the day. And here at Trusted Senior Specialist, when it comes to your Medicare, it's all about love and trust. Until next time, see you.